Femoroacetabular impingement type patients, although I'll talk a bit about that later, I often try and activate their glutes in those sorts of scenarios, so I might not have to take through the front. But this is a nice way, and also starting to think about your kinetic chains as well. So we're going to start from the top third of the quad, and we're going to go into the lower oblique, so about a third of the way down. It's been a long day already. So we've got about that sort of length there. I'll do pink just so it stands out for you.
Okay, ASIS to
just above the ASIS, because I allow my anchor to be about the 5 to 10 centimetre line above that. Now I've got Bernard sitting on the edge of the bed so that he's in a little bit of hip extension, so you could actually pop your hands back further. We're trying to actually stretch over that joint. If your patient's really mobile and able, most of the patients who are doing this on probably can't do this, but you could get them into your Thomas test position on the edge of the bed. You might actually be extending into their quad if they've got some quad strain or something else you're trying to assist. So it depends what you're trying to achieve there as to your position. For the purpose of today, we'll show you in this position. Okay, so I'm just going to wiggle your shorts up a little bit just so I can see where we're going. I'm going to go up the centre of the rec fem, and then we're going to go over the anterior hip joint and then finish just above the ASIS. So we're going to place, take down again, same application as previously. Now you have to wedge your patient up a little bit in that I keep the backing paper on most of this to start with, because then it's not going to stick to the clothing. And then Bernard, what I'll get you to do is you're going to work with me from the top, and I'm going to feed it through from the bottom. Okay, so if you go in from the top, it's always good, you don't have to get too up close and personal with the patient. Feed them through, just make sure you take both backing paper and that, got it? Excellent. Okay, now they're kind of taking control of the stretch there, they could place it down, but I usually take over them. Thank you. I'll peel it back, so I've now got nice control of exactly where I'm going to take. Just lay back into, in fact, if you're able to lay it back onto the bed for me. Okay. Yeah, so we're actually into a little bit more stretch, and then placing the last part down. Okay, so I've gone right over the anterior hip joint, and you can also obviously use this for obliques. I use it a lot with fast bowlers where we're trying to actually encourage rotation and different positions too for retraining. Or the oblique strain. So I've just shown you the hip part, but you could then add your compression over the hip joint itself. You could add rotation if you're trying to get some oblique stability, or if it's into the rec fem, we might even be extending down the quad and have your compression over that spot. Okay, but I partly want you to practice the looping it through clothing as well. There's nothing worse than when you show a patient and then you just end up in this sticky mess and oh my god, it's so embarrassing. So have practice of that just so you get really confident, and also the ankle.